Hello everyone. Let's start the next 10 MCQs for NEET MDS preparation. 31 question. Following foramina are found in greater wing of sphenoid except. So the correct answer for question number 31 is optic canal. So foramen rotundum, spinosum and canaliculus innominatus are the foraminas found in greater wing of sphenoid. 32 question. In a 5-year-old child, which of the following foramina is located in the posterior cranial fossa? So the options are jugular foramen, B. foramen rotundum, foramen spinosum and foramen lucidum. So the correct answer for question number 32 is option A, which is jugular foramen. So jugular foramen is the foramen in a 5-year-old child is located in the posterior cranial fossa. So jugular foramen is the correct answer. Question number 33. The typical cervical differs from the thoracic vertebra in that it, option A, has a triangular body, option B has a foramen transversarium, option C, superior articular facet directed backwards and upward, has a large vertebral body. So the correct answer for the question number 33 is option B, has a foramen transversarium. Question number 34. The joint between the atlas and the axis is option A, synovial, option B, closely related to the first cervical nerve, option C, allow rotation of the head, option D, supported by the alar ligament. The correct answer for question number 34 is option C, which is allows rotation of the head. Question number 35. The joint between the two bony surface linked by a cartilage in the plane of body is called option A, syndesmosis, option B, symphysis, option C, synchondrosis and option D, suture. So the correct answer for question number 35 is option C, which is synchondrosis. So the joint between the two bony surface linked by a cartilage is the plane in the plane of a body is called synchondrosis. Question number 36. Which out of the following bone ossify first? So the options are A, mandible, B, nasal bone, C, vomer and D, occipital. So the correct answer for question number 36 is option A. For 35 is option C. So the correct answer for question number 36 is option A, which is mandible. So now the next MCQ, the type of suture represented by sagittal suture of the cranial vault is A, serrated, B, denticulate, C, squamous and D, plain. The correct answer for 37 is A, serrate. So serrate type of suture represented by the sagittal suture of the cranial vault. 38th MCQ. Which of the following is the weakest part of the orbit? Option A, medial wall, option B, lateral wall, option C, floor of the orbit and option D, roof of the orbit. So the correct answer for 38th MCQ is medial wall. So medial wall is the weakest part. Now 39th MCQ, the hyoid bone lies in the midline at the front of the neck at the level of the third cervical vertebra, fourth cervical vertebra, fifth cervical vertebra and seventh cervical vertebra. So the correct answer for 39th MCQ is third cervical vertebra. 40th MCQ, the orbital opening is somewhat. So the correct answer is quadrangular. So we are done with the 10 MCQs. Now we will revise once again. Foramen are found in greater wing of sphenoid except. So the correct answer for 31 MCQ is option D, optical canal. So in a 5-year-old child, which of the following foramen is located in the posterior cranial fossa? The correct answer is option A, jugular foramen. 33. The typical cervical differs from thoracic vertebra in that it is. The correct answer is option B, which has the foramen transversarium. 34th MCQ, the joint between the atlas and the axis is. So correct answer is option C, allows rotation of the head. 35. The joint between the two bony surface linked by a cartilage in the plane of the body is called synchondrosis. 36th MCQ, which one of the following bone ossify first is option A, which is mandible. 37th MCQ, the type of suture represented by the sagittal suture of the cranial vault is serrate. Option A is the correct answer. Which one of the following is the weakest part of the orbit is the medial wall? The hyoid bone lies in the midline at the front of the neck at the level of the third cervical vertebra, which is option A. The orbital opening is somewhat quadrangular. So the correct answer for 40th MCQ is quadrangular. So now we have revised twice the last 10 MCQs. Please go through again and again for complete understanding. If you have any doubts, please comment and subscribe to my channel. By end of the week, we will be revising all the 70 MCQs, which will be revised and memorized as easy as possible for the upcoming uploads. Hope this video finds helpful to the NEET aspirants who are starting to study from the first year BDS, and all the best for your future exams. Thank you.